In this lecture, we will cover the restorative instruments that we'll be using in class this semester. There are two different types of instruments that we'll be using in this class. There's the hand instruments, and then there's the rotary instruments. We'll start off by talking about the hand instruments. So here we have a picture of what your hand instruments are that you'll be using for operative. This is a continuation of some of the other instruments that we'll be using. So hand instruments, they're universal. They're designed to be used by both left and right-handed operators. And the metal that it's made out of, typically today it's stainless steel, and that's because of the sterilization process that our instruments have to go through. The carbon steel will rust and just isn't as good. So typically, like I said, the stainless steel is what we use. There's two different types of hand instruments. We have non-cutting instruments and we have cutting instruments. So cutting either the tooth or the restorative material. The non-cutting instruments, those are things like your mirror, your explorer, your periodontal probe, the forceps, plastic instruments, the amalgam instruments, and the spatulas. Our cutting instruments, there's two different types. There's tooth cutting and there's restorative material cutting. So your tooth cutting will be your hatchets, chisels, hoes, gingival margin trimmers, and spoons. And then your restorative cutting instruments are things like your cleoid, discoid, Hollenbeck, and interproximal. And you should already be familiar with the carvers because you've used those in your waxing class. Basic elements of a hand instrument, the different parts. A there, that's the blade. That's the part that is used to actually cut. In the non-cutting instruments, that part is called the nib. B, that's the shank. So that's what connects the blade to the handle of the instrument. Then C is the handle or the shaft, and that's the part that you actually hold on to. So on the cutting instruments, your blade is going to have different cutting edges. At the very tip of it there, that's going to be your primary cutting edge, and then the sides of that blade are secondary cutting edges. So both the tip and the sides of the blade will cut. Shank design, remember the shank is what connects the blade to the handle. So there's different designs to the shanks. You can have different amounts of bends in that shank. And the reason that you would have those bends there is to receive better access to a specific part of the tooth, to have better control of the instrument. It allows for better distribution of the forces. When you bring the cutting edge of that blade to within 2 millimeters of that central axis of the handle, it creates a better balance of the instrument than if it was further away than 2 millimeters from that central axis. There's different factors that affect the control of the hand instruments. We already talked about it a little bit here, but this goes into it just a little bit more detail. In the figure here, it kind of shows you what we mean by bringing the cutting edge to within 2 millimeters of that central axis. So the things that give us greater control of a hand instrument is a larger blade, a minimum number of bends in that shank, and then bringing that cutting edge to within the 2 millimeters of that central axis of the handle. For our cutting hand instruments, G.V. Black came up with different formulas to describe those instruments to us and to be used for when ordering instruments or when talking about them. So for cutting instruments, there's two different types of formulas. There's a 3-number formula and there is a 4-number formula. Here, this is depicting the 3-number formula. So the 3 numbers in that formula are that first number is always going to be the width of the blade in 0.1 millimeters. So on this blade here in the picture, it's 1 millimeter wide. That primary cutting edge is 1 millimeter wide. So your first number is going to be 10 because there's 10 tenths of a millimeter in 1 millimeter. The second number in the 3-number formula is going to be the length of the blade in millimeters. So in this picture here, the length of that blade is 7 millimeters. So our second number is 7. The third number is going to be the angle of the blade to the shaft in degrees centigrade. Okay, so the angle that is made between that blade and the center of that shaft in this case is 14 degrees centigrade. So we're used to the 360-degree circle, but in this case, that third number is in centigrade. So a centigrade circle goes from 0 to 100 degrees. Here we have the 4-number formula. So a 4-number formula is going to be used when the cutting edge, that primary cutting edge, is not at a right angle to the long axis of the blade. And I'll show you a picture of that on the next slide, what that means. So in a 4-number formula, the first number is going to be the same as what it was in the 3-number formula. The first number is the width of the blade in tenths of a millimeter. So in this case, it's 1.3 millimeters wide, so it's going to be 13 is the first number in the 4-number formula. The second number is going to be the angle that the primary cutting edge makes to the long axis of that handle in degrees centigrade. In this case, it's 95 degrees, so our second number is 95. The third number is going to be the length of the blade in millimeters. In this case, it's 8 millimeters long, so our third number is 8. The fourth number is going to be the angle that that blade makes to the shaft in degrees centigrade. So in this case, it's 14 degrees centigrade, so our fourth number is 14. So this instrument is a 13, 95, 8, 14 instrument. So here the picture on the left depicts what we mean by that primary cutting edge not being at 90 degrees to the length of the blade. The picture on the right there just kind of goes through and tells you what each number is in that 4-number formula. So again, on this picture, number 1, the first number, is going to be the width of that blade in tenths of a millimeter. So it was 1 millimeter wide, so that first number is 10. The second number is going to be the angle that is made between that primary cutting edge and the shaft, and that angle in this case is 8.5 degrees centigrade, so the second number is 8.5. The third number is going to be the length of the blade in millimeters. In this case, it's 8 millimeters long, so the third number is 8. The fourth number is going to be the angle that is made between the handle and the long axis of that handle. The blade, the length of the blade and the long axis of the handle, so that is 14 degrees centigrade. So our fourth number is 14. So this would be a 10, 8.5, 8, 14 instrument. Now we'll go ahead and we'll talk about our non-cutting instruments. The first one that we'll talk about is our mirror. This is going to be the most commonly used instrument that you have in dentistry. You use it for almost everything that you do. It's used to have indirect vision, to be able to see things that you can't have direct vision to within the mouth. It is used to reflect light onto different areas of the teeth. It's used to retract tissue. Really, its main use is to save your back and neck. Without a mirror, things would be much more difficult on our bodies in dentistry. So here it depicts what indirect vision is. You're able to use that mirror to see surfaces that you're not able to look at directly, so you can reflect the image of the lingual surface of those maxillary teeth up to your eyes when you're sitting straight up. It's used often to reflect the light. So here you have that overhead light shining on the mirror, and then that light bounces off the mirror onto a certain part of the tooth so that you're able to see that area a little bit better. Transillumination is where you reflect that light through the teeth, and that is used sometimes in detecting caries. Retracting soft tissue, you use a mirror all the time to retract soft tissue. You use it to pull that tongue out of the way, or to pull a cheek out of the way, or the lips out of the way so that you're able to see different areas of the mouth. And primarily it's used to save your back and neck. You don't want to be bending over your patient like this all the time. The mirror allows us to sit up straight and have good ergonomics as we practice dentistry. The second most common instrument that we will be using is the Explorer. This is basically your fine feeler. Your fingers are big and they're not going to be able to feel small discrepancies in your restorations or in the tooth. So we use the Explorer to feel those type of things. They can be used to detect caries, they can be used to check the smoothness of a restoration or a tooth preparation, They can be used to check the margins of your restorations. Cotton forceps. We use cotton forceps quite frequently to pick up small objects, basically. We use it to place and remove cotton rolls or pellets, to place and remove wedges or cord, things of that nature. Hemostatic forceps are a little bit more rigid than the cotton forceps, so you're able to really hold on to something a lot better. They are able to be locked in place. Articulating paper forceps, we use these to hold our articulating paper so that we can check a patient's occlusion. It holds basically the articulating paper in there, and we're able to put that paper wherever we need to have the patient bite together, and then it'll put those marks onto the teeth there to tell us where that patient is occluding. Spatulas we'll use to mix and carry different cements and liners. On the left-hand side of this instrument here is the spatula. On the right side is a little ball, kind of like a ball burnisher, that you're able to use to pick up the cement or liner that you've mixed and then carry it over to the tooth. Next we have our amalgam instruments. We've got different types of amalgam instruments. There's carriers, condensers, and burnishers. The carriers is just like the name says, you carry the amalgam from a well to the tooth preparation inside of the amalgam carrier. Condensers, we use them to compress and condense our amalgam into all areas of that preparation. And then the burnishers are used to contour matrix bands for the final condensation of amalgams and in shaping occlusal surfaces of amalgams and smoothing that amalgam surface. So we'll show you what each one of these is. So here's your amalgam carrier. It has two different ends, a large end and a small end. And when we get to restoring amalgam, we'll go more in depth into how you use this instrument. But it basically carries the amalgam from an amalgam well that's pictured there on the bottom left over to the tooth preparation that's pictured on the bottom right. Here are your amalgam condensers. We have three different sizes of amalgam condensers, and each end of the amalgam condenser is a different size. So we go from the smallest on the top left there to the very largest condenser down on the bottom right. And that's to push that amalgam down into your preparation and to condense it into the preparation. So here this is kind of showing what we can do with an amalgam condenser. You can push both vertically and horizontally with that instrument to help condense that amalgam and push it into all parts of your preparation. And here is a picture of an amalgam burnisher. This is an acorn burnisher on the top there. And then we have different shapes of burnishers that are depicted there on the bottom left. So you have ones that can look like a paddle, you have ones that can be triangular in shape, you have ones that can be like a teardrop almost. So that is our burnisher. Next we have our plastic instruments. These are used for placing and shaping composite material into the tooth preparation. They can also have some other uses like packing cord, but typically we use these most often to place and shape the composite material before it's cured. Okay, now we'll go on to our cutting instruments. Here we have our tooth cutting hand instruments. These are our hatchets, chisels, hoes, and gingival margin trimmers. These are used to cut the enamel and the dentin inside of a cavity preparation, especially in areas where it's hard to reach with like a burr or something like that. So a hatchet and gingival margin trimmers and the chisels and the hoes, they are used in either a push or a pull stroke. Typically the push stroke is going to be more effective, and the pull stroke in conjunction with the push stroke is used more for polishing of a surface and smoothing it. I said the hand instruments are sometimes used where a burr, it is difficult for them to reach without doing additional damage. In the picture on the right there, you can see the burr itself spins, and so it makes a round cut. It can leave little enamel projections out there, and sometimes it's easier to get those with a hand instrument instead of the burr so that you diminish the risk of damaging the adjacent tooth or having to widen your prep significantly. Here we have a hatchet shown in the picture on the left there. A hatchet, the primary cutting blade is in line with the long axis of that handle. That differentiates it from the chisel and the hoe because those are more at a right angle to that long axis of the handle. Here we have pictured the chisels and the hoes. On the left there is a chisel, on the right are two different hoes. The difference between a chisel and a hoe, the chisel is more straight, and a hoe, the cutting edges are at either a right angle or at an angle greater than 12 degrees from that long axis of the handle, where a chisel is going to be either straight or less than 12 degrees off from the long axis of that handle. And then again, the difference between a chisel and a hoe and a hatchet is that the hatchet, the blade is bent so that the primary cutting edge is in line with the long axis of the handle, whereas a chisel and a hoe is off angle. It's at 90 degrees to that long axis of the handle. Here we have pictured the gingival margin trimmer. This is the only 4-number formula instrument that we have, the gingival margin trimmer. The hatchet and the chisel and the hoe are all 3-number formulas, whereas the gingival margin trimmer is a 4-number formula. And that is because the primary cutting edge is at an off angle to the long axis of that handle, or not the handle, but the blade itself. So here you can see in the picture on the right that a gingival margin trimmer, they are designed to trim the margins either on the mesial or the distal of a tooth. A there is depicting a mesial gingival margin trimmer. B is a distal gingival margin trimmer, and C is what a hatchet looks like. And if you look at the primary cutting edge there on C, you can see that it is at 90 degrees to the blade, whereas A and B there, the gingival margin trimmers, they are not at 90 degrees compared to the blade. Here we have our spoons. These are typically used to remove carious dentin or debris from the cavity preparations. Spoons, I think, are overutilized by our students a lot of times, where they should be using a large round burr at low speed. And we'll talk about this several times throughout the operative courses. But spoons can be used to remove carious dentin, but that should not be your primary tool when you're trying to remove carious dentin. It should be a large round burr at slow speeds, and we'll talk about that more, like I said. So here we can see that spoons come in kind of different shapes. You've got a discoid type spoon that is in A and B there. In C, we have more what's called a banana spoon, where the blades go all the way up the side of that blade there, the length of the blade. And then we have our amalgam carvers. These are things that you should already be familiar with. We have our interproximal carver on the top there, our Hollenbeck carver in the middle, and the cleoid discoid carver is pictured there at the bottom. You've used these in your waxing course previously. We use these same instruments for our amalgam restorative material. Here's a close-up of the cleoid discoid. On the picture on the upper right there, we have the cleoid up top and then the discoid down below. Like I said, they're used to carve the amalgam. Okay, on to rotary instruments. This is the handpiece and burrs that go along with it, so we'll talk all about that now. The rotary instruments are a lot more efficient, I would say, than the hand instruments. I don't want to say that hand instruments don't have a place or aren't that important, because they definitely do, and there are instances when you need a hand instrument, but definitely the rotary instruments should be your new friend. This is what you want to learn to use the most, because it will make doing dentistry so much easier and so much quicker. A lot of students rely too much, I would say, on the hand instruments to make little fine corrections. You need to learn to use the hand piece to where you can do those fine corrections, because it is quite a bit more efficient to be using a handpiece than it is the hand instruments. So rotary instruments, they are classified by being either contra-angle or straight. The one that we use most in operative dentistry is going to be the contra-angle handpiece. There's the high speed, the slow speed that are in the contra-angle. High speed is going to be used for most of your cutting of the tooth structure. Slow speed is going to be used more for caries removal and for polishing of restorations. The straight handpiece is used more in either oral surgery or in adjusting removable prostheses like dentures and RPDs. But in this class, like I said, we're going to use a contra-angle. Contra-angle means that the burr itself is at an angle other than in line with the handle of that handpiece. The straight handpiece, the burr is in line with the handpiece itself, whereas a contra-angle, it's at an off angle. And they put it at that off angle to help get the tip of that burr to within that 2 millimeters of that long axis of the handle so that you have better control with it. Okay, so the high-speed handpiece, like I said, it's the one that we use most often in operative dentistry. It runs between about 100,000 and 200,000 RPMs, although you'll see with the electric handpieces that we use here at the school, you can run the high-speed handpiece very low, actually, to where you're down at like 500 RPMs. So you can use it at slow speeds, you can use it at high speeds with the electric handpieces that we have. But at high speeds, you're going to use this handpiece for gross tooth reduction. The advantage is that it's going to remove tooth structure a lot faster. It's going to give you less pressure and vibration than the slow speeds will. The disadvantage is that it does generate high heat, so you should always be using a high-speed handpiece with water and air spray so that you don't heat up the tooth and the pulp inside there and do damage to the tooth. Here we have the slow-speed handpiece. Typically the slow speed will be used in a range of 100 to 40,000 RPMs. The main difference between the slow-speed handpiece and the high speed that we have here is that the slow speed allows you to use what's called the latch burr, and we'll talk about that in a minute. But the slow speed handpiece, like I said, is used typically for caries removal and for maybe small preparation refinements, but typically for caries removal and then finishing and polishing of your restorations. The disadvantages of a slow speed handpiece is that it creates a lot of vibration, which can be annoying to the patient. It has a tendency to kind of skip inside the preparation there, so you have to make sure that you're holding on to it good, but it is much better for using something like this for caries removal because if you get it down to a slow speed, it will only remove the carious material and not the hard good tooth structure. Here we have pictured the straight handpiece. Like I said, it's used more in removable pros or lab procedures or in oral surgery. We have two different types of handpieces. There are electric handpieces and air-driven handpieces. Here at the school, we use electric handpieces. Air-driven are very common as well, though. They were the first handpieces that we had were the air-driven handpieces, and then in the last 20 years or so, electric has become very popular. Electric handpieces are typically more expensive. They're typically a little bit larger and heavier. They do have higher torque, which is an advantage. The higher torque allows the burr to keep spinning at high speed, even though you're putting pressure on the tooth. In an air-driven handpiece, it has less torque. So what happens when you have a high-speed spinning burr and you touch the tooth, it's going to kind of bog down and slow down as you push into that tooth. So the electric handpiece, the advantage is that it has that higher torque. Another advantage of an electric handpiece is that you can adjust the speed of your handpiece just manually. You can put it into the control box, whatever speed you want, and it'll go that speed. With an air-driven handpiece, you use the rheostat to control how fast it's going, so you press harder to make it go faster, or you just barely push on it to make it go a little bit slower, so you don't know exactly what speed you're really going at. The electric handpiece typically has less vibration and noise than the air-driven handpiece, and it is more efficient at cutting because of the higher torque that it has. The air-driven handpieces, the advantages of it is typically less expensive, it's smaller and lighter, so it's easier to get to hard-to-reach places inside of the mouth. But like I said, the disadvantages are that it has less torque, so it does tend to bog down and it takes longer to do like a crown prep or something like that with an air-driven compared to the electric. It does typically have a little bit more vibration and noise, and it's not as efficient at cutting. I'll talk about the most important part of the handpiece. That's the burr, the part that goes inside the handpiece and spins and actually cuts or polishes the tooth. Burrs that are designed to cut the tooth structure have a series of metal cutting edges that are called blades or flutes. The instrument has to obviously be harder than the substance being cut. Enamel is an extremely hard substance, so they have developed what's called tungsten carbide. And then another material that is commonly used in cutting tooth structure is diamond. So we'll talk about the carbide burrs first, and then at the end we'll talk just briefly about the diamond burrs. Burrs have different parts to them, just like our hand instruments. There's the shank, the neck, and the head. The shank is the part that fits inside the handpiece. There's 3 different types of shanks for the 3 different types of handpieces that we use. There's the straight burr, the straight shank, which is used for the straight handpiece, and the shank on that is longer than what the shank is for our friction grip or latch type burrs. The latch type burr is going to be used in your slow speed handpiece. If you look at the shank in the picture on the right there, for the latch type, it's the one in the middle. You see that it has a little latch at the end of it there, and that is so that it locks into the head of your handpiece so that the burr doesn't fall out. The friction grip is what is used inside of the high-speed handpiece, and it relies on friction to hold itself inside the head of the handpiece. So it doesn't need the latch there to hold it in. So then the next part is the neck, and that's just what connects the shank to the head of the burr. And the head of the burr is that working part of the instrument. It's the part that has the flutes on it or the blades to be able to cut the tooth structure, or it has the diamond impregnated particles to be able to cut the tooth structure.